Hi, my name is Matt Perry, and I'm here to start our presentation. Our topic chosen was PhD nursing. This was chosen because, for me personally, I have an ultimate goal of becoming a nurse educator in the college setting. So this topic was very interesting to me. Is there a need? Yes, there is an extreme need. Approximately 50% of nursing educators have a PhD, according to the American Association of Colleges of Nursing. And this number is getting worse every year as the current group of instructors, as they get a little bit older and start retiring, there are not people that are educated with PhDs that are taking their place. I'm now going to pass it on to one of my fellow students for the continuation of this presentation.
Requirements and qualifications. Educational experience may be earned while trying to complete the degree. Working in a healthcare organization or a college or university institute will help you gain the educational experience needed to continue on a successful career path and for the PhD doctoral degree. The degree could take an additional 1 to 3 years after completion of a graduate level program, depending on the doctorate degree selected. Meaning you will probably have to take a residency in that specific area in order to earn the knowledge needed for the degree and get the experience you need as well. Also, you may have to take an additional 2 years of bedside nursing as necessary, depending on the area of research or teaching that you decide to pursue. Educational requirements and qualifications are having a standard RN license, as well as taking the GRE or graduate record examination and turning in the scores for that specific area. Also, you'll need to have either a BSN, which is a bachelor's degree in nursing, or a mastery level degree in nursing in order to be eligible for the PhD program. Turning in your college transcripts from wherever you got your BSN or mastery level degree. Letters of recommendation, and also an essay explaining the reason you want to get into the the PhD program. Licensure for the PhD program would only be your registered nursing license for where you practice as far as the state. That's the only thing needed for the PhD program. Certifications for PhD. Well, PhD certifications are normally a voluntary process in which the individual takes an exam in a specialty area like oncology, cardiology, pediatrics, or specialties as such. Usually, a certification is something that measures the purpose of a professional recognition, meaning if you were to take an exam for a certification, that certification would basically just show that you're proficient in that specific area. An academic degree earned by an individual while successfully in completing the requisite course of study is for that degree. Examinations taken or examination tests taken for competencies are for a role, not a degree. Examination degrees at that level will be too broad to determine the knowledge and skills that are applicable to the roles or specialties related to that role.
My name is Chioma Okafor. I'm in a BSN program. So I'm going to do a presentation on the major responsibilities of a PH holder. A PH holder is a research and science oriented. Basically, PH holders do a lot of research. They prepare graduates to develop new evidence-based practice knowledge for nursing professions. They are good in statistics, they analyze data, and they're also in scientific theories. They are also hold posts in administrations. PhD holders are administrators in hospitals and also healthcare agencies, medical and nursing schools. They also possess management and leadership skills. As most of them are, you find them as directors in home agencies, director of nursing in hospitals. Also, they can also practice as nurse practitioners. PhD holders practice as nurse practitioners with the right credentials. They can own their own clinic where they can practice because they are able to write prescriptions as medical doctors. PhD holders they are qualified nursing educators. In most nursing colleges and universities, PhD holders hold a post as professors and deans of the colleges. They have the qualifications as nursing staff to teach the nursing students and also the graduates, and also help them to transition into master's degree or PhD degree also. They can also be acknowledged as experts in our society and our communities. As a valid member of the communities, PhD holders are recognized and also they are valued as any other medical profession with the same doctorate level educations, just like the medical doctors, because they have the title doctor in front of their name. PhD holders, do they have standard of care? Yeah, sometimes they do, because since their practice is based on mostly research, those researches they are used for immediate effect for patients' care. How about the research they do? That's how they find out a lot of new development towards patients' care. They work in healthcare delivery systems as advanced nurse practitioners to provide clinical healthcare services to the community, not only to the community, to the hospital settings or any agency where they find themselves. They implement this evidence-based practice used in clinicals and nursing cultures by nursing students. Go to clinicals, they always teach us to use the evidence-based practice. They lead researches. That's what they do. They lead researches, they design, and they implement those studies. Who are the ones that write our courses for nursing programs or the courses for nursing programs? They are the PhDs. Who are those ones? Sometimes they write the textbooks used for in nursing schools. They are the PhDs. So these studies to address, they write all this and implement these studies to address courses and care system towards patients' care. Because they write all these studies, we as nursing students will be able to use it to implement it when we work, not only in the classroom but also in the outside world. My website is below my PowerPoint, and this concludes my presentation for tonight. Thank you.
Hello, my name is Jennifer McCarthy. I'm doing the section on PhD of shortages, outcomes, reform, and quality. So let's start with shortages. So why do we have shortages in the PhD department? Well, like any other area in the healthcare system, for nursing example, let's use them as an example, you have to relinquish what's going out the door. So it seems like every couple of years we have a retiring boom and a lot of people go out the door, but who's going to come in the door? As far as PhDs go, I mean, they've done studies, but let's see, between 2003 and 2004, and then 13 and 14, showing that there was an increase in PhD degrees being obtained. I think it was by about 50,000 people in America. But if we think about it, why is it that not everybody is going on to obtain and get a PhD degree? Is it due to financial responsibilities? Have we taken out too many student loans and unable to afford certain colleges? Online versus being in the classroom? Do you benefit from being online? I feel like you don't, especially if you're getting a PhD or doctorate. Hands-on is going to be the most beneficial, I think, for someone that's going to learn, versus an Ivy League school and a collegiate college. Let's say Florida State University versus Yale. So it all depends on your prerequisites as well as getting in. What else? It could be family issues. Being a mother and being older and having more responsibilities makes it harder to obtain a PhD degree. Moving on. Next, we have outcomes. So once you obtain your PhD degree, of course, you graduate from school after many, many years in school, and it seems like dissertation is your final project. Obviously, I'm very bad at public speaking, so even if I know what I'm talking about, I feel like passing that dissertation would be the biggest part of your whole entire project. Job stability would be a great outcome. The healthcare system is growing and ever-changing. A PhD would probably solidify a good job here in America, whether it's with a hospital that's magnet or a nursing home or business or an office type setting. And then after you obtain your PhD degree, all that money that you have well spent, hopefully you earn all that money back. I think they roughly make anywhere over between $100,000 and $200,000 is what I read. So who knows how many student loans you took out, but it's obviously a great commitment towards a PhD and having the outcomes be what they are. Next is going to be reform. So reform means making changes. What can we do when you're making changes? Well, in healthcare, it's ever so changing, and you're doing CEUs continuously, even to keep up your license. So do you feel that we change with time, or do they change with time? So what I mean by that is when you look at my PowerPoint presentation, it says, do we change or do they change? The action of process of reforming an institution or practice. So once we get our PhD, have we conformed to what the school has made us, or do we go out on a limb and be a better type of person with the degree that we have? Do we continue to do our CEUs like we're supposed to? Well, yes, if you want to keep your license, obviously. But I don't think that school should change who we generally are. So that's what I mean by that. And last but not least is quality. So the quality of a PhD, again, I feel like this almost goes back to online versus in a classroom setting, and the type of school that you go to and the grades that you make. What is the overall quality of your PhD? Does it mean that you're better than everybody else around? Maybe might mean that you're definitely obviously smarter than everybody else around, but that's the other question. Does it take intelligence to get into a PhD program? Well, yes, obviously it takes grades, but more than the fact, I think it takes what we call diligence. And when we look diligence up, it's being strong, forward, you're studying, you put in the hard work, and you do what you do. So does it really take intelligence to be a doctor? Probably not. It's more how focused are you and what do you want your outcome of life to be like. So as far as quality, if I was to obtain my PhD and go on in something into the labor and delivery field, I would still have the same personality that I have now with all of the education backing that. I would hope that everyone would listen to me, teamwork with me, but understand that I hold the power, which would be the certificate of the PhD and the title that I've so truly hardly worked for. And then I have my references. Thank you very much.
Hi, my name is Chris McGrath. I'll be talking to you about the role of the PhD nurse in regarding to healthcare economics evidence-based practice, and legal issues. Starting with healthcare economics, if we look at this graph from the Center of Medicare and Medicaid Services, we can see two lines, the red line representing national healthcare expenditures and the blue line representing gross domestic product. And over the last 30 years, we can see that the expenditures for healthcare have outpaced gross domestic product. It's especially prevalent in years of recession, highlighted in the blue bars here. So we are generally aware that healthcare costs have continued to rise. So we've established that healthcare costs are continuing to rise against GDP, and we expect that to continue into the future. Right now, healthcare spending accounts for 18% of the total U.S. economy. So for every dollar of value produced by the U.S., 18 cents of it goes to pay towards healthcare. Of that 18%, about a third of it goes to pay for hospital costs. So every 6 cents of every $1 produced by the U.S. goes to pay for healthcare costs in hospitals. And how can we ameliorate that in the clinical setting? Well, an article by Staffolino, Weidman, and Carlson entitled Financial and Clinical Benefits with a Hospital-Based PhD outlines some methods in which a PhD-trained nurse can help go to truncate costs in the hospital environment. In a different article by Berweth and Hackbar entitled Eliminating Waste in U.S. Healthcare, they really highlighted that rather than truncate or eliminate services, there's a lot of waste currently in the system that can be addressed. They thought that it was about 20% of total healthcare costs. And they had 6 suggestions for helping to eliminate waste, 4 of which were really applicable towards a PhD nurse. They can help address overtreatment. Are we doing too much at end of care? Too many tests? Too much lab work? Failures of care coordination. Are people able to get follow-up care? Are they being seen by the right specialists? Failures in execution of care processes. Many times we have multiple diagnoses in the hospital, and care is very complex. In addition, the PhD-trained nurse is suited towards leadership roles in the hospital and bureaucracy and administrative roles, and they can go and use their expertise towards reducing the complexity in the hospital. So we've established that costs are rising in healthcare, and PhD nurses can help reduce costs through elimination of waste. How do they do this? By participating in implementing evidence-based practice. We have this graphic up here. It's a reminder of what evidence-based practice is. Client values, what does the client need? What are their cultural values, backgrounds? The professional expertise of the bedside nurse practice, the tasks that are involved in delivering care to the patient. And the part that gets often skipped over in the clinical setting is evidence-based practice, and that's what PhD nurses are really there to implement in the clinical setting. And Staffolino, Wildman, and Carlson pointed out 7 ways in which the PhD-trained nurse contributes. So assessing the needs of nursing related to research and evidence-based practice. What problems are bedside nurses encountering that need to be addressed? Raising awareness. Are people aware of what best practices are? A lot of times, bedside nurses don't have time to either go do research while they're on the job. Present research in a way that is understandable and meaningful. Reduce complexity, reduce the verbiage, explain in common language just like nurses do to their patients. And empower nurses to engage in research-related activities. A lot of times, nurses have good ideas for process improvement, and reaching out and communicating to the bedside nurse will allow for ideas to come to fruition and new ways of thoughts and practice to occur. The PhD nurse can also help disseminate information to the bedside nurse by interpreting data, identifying trends, and helping with patient care. They can network in the community and with the multidisciplinary team. A lot of times people are intimidated by doctors because they're high level of education. Well, the PhD nurse is on equal footing, and it puts her on a good standing to communicate with people with high levels of learning. And they can also write proposals to implement new plans for care, help implement some of this evidence-based practice in the clinical setting. So what are the results of implementing evidence-based practice? Staff Alina, Weidman, and Carlson had some pretty optimistic numbers. They said that due to all the hospital-acquired conditions that patients suffer, it can cost a hospital to have costs of in excess of $12 million a year. And they thought by implementing a PhD nurse into the clinic, they could potentially reduce those costs by $9 million. We see several hospital-acquired conditions, falls, pressure ulcers, UTIs, and by implementing evidence-based practice, we are able to save a lot of money in the healthcare chain. And this is ultimately one of the benefits of the educated nurse, in this case, the PhD nurse. Regarding legal issues for the PhD nurse, there's not a lot of information available right now. I found a really good article from Anderson and Christensen about the positioning of PhD nurses in the clinical setting. It's based in Denmark. To the point, the first PhD nurse in Denmark graduated in 1993, so it's really a new field. And they found that it's multifactorial as far as what the duties are considered. They're really responsible for implementing evidence-based practice in the clinic and to promote it in nursing culture. And they have a lot of hats to wear, including research, teaching both students and nurses, advancing evidence-based practice in the workplace, and also doing clinical duties as well. There's a lot of ambiguity as to what their roles are, so the legal issues are really evolving at this point. That being said, the PhD nurse is a reference person for clinical nurses at the bedside, so they're expected to know the scope of practice of a nurse and be able to provide a reference if someone has a question. And the same thing is applicable towards students. Since they have a teaching role, they should be able to inform a student what their scope of practice is in the clinical setting. And one of the big things for anyone with a greater degree of knowledge is to not exceed the scope of practice. A nurse may believe that a chest tube should be unclamped after a physician or other provider clamps it, but that would really exceed the practice of the scope of nursing. So we've got to be practiced not to exceed our scope.
And lastly, our references. Thank you for watching our video.